Bukanga County in Isinjiro district is a vast expanse of verdant rolling hills that seem to stretch to the horizon. To the south, the hills rise and fall into Tanzania, and to the far west into Rwanda. The Nakivale Refugee Settlement is nestled somewhere in between. Refugees enjoy relative freedom in addition to being allotted plots of land to grow food to supplement the World Food Programme's provisions. This benevolence is one of the things that have endeared the Ugandan government to the Western donor community, despite its worsening repressive behavior. Anike Iradukunda has brought her daughter to Nakivale Health Center 3 for treatment. She fled the political violence in Burundi in 2012 and settled in the refugee settlement.
There has been incremental reduction in assistance for refugees, and life is increasingly becoming unbearable here. Some of us with families, it is even worse. There are no jobs, food was rationed, and getting health care is also hard.
Her story mirrors that of several refugees. The in-charge of Nakivale Health Center 3, Dr. Collins Mugisa, describes the surge of patients outstripping the available resources.
Standard level 3 is supposed to have a catchment population of 25,000. Also, a level 4 is supposed to have a catchment population of 75,000. By looking at the statistics, it means Nakivale has even surpassed the level 4 catchment population. In terms of staffing, as of today, Nakivale, we are a total of 84 staffs. Out of these, 20 are from Isinjiro district local government, go through the MOH, and 64 as the staffs that are supported through MTI and UNHCR. Also, to note here is that MOH recommends the new structure of staffing that level 3 should have 75 and level 4 should have 130. That can easily explain why we have issues with human resources.
By the Ministry of Health standards, a health center 3 is supposed to serve a catchment area of 25,000 people, meaning this facility is overstretched. Education, too, is experiencing severe structural hurdles, worsened recently by the unfolding steep aid cuts. As for food, the World Food Programme started rationing food distributions last year in May.
The refugee response in Uganda is experiencing a significant funding gap as part of wider global reductions in humanitarian assistance. However, Uganda continues to host one of the largest populations in the world. We're talking about 2 million refugees and asylum seekers.
Uganda's refugee response plan since 2025 requires at least $980 million or 3.6 trillion shillings to cater for the 2 million refugee population. However, only $300 million or 1.1 trillion shillings has been released. The institutionalized corruption in the government and the NGO sector has over the years put off donors who demand tighter operational and financial controls. As a result, the UNHCR's Associate Communications Officer, Frank Walusimbi, says they have had to reduce field presence and undertake a comprehensive review of operations.
These are very difficult decisions, but necessary to ensure that life-saving assistance and core protection activities can be sustained to the greatest extent possible.
Walusimbi adds that funding reductions have affected a number of partner organizations that play a critical role in delivering assistance at community level.
Impact is being felt across several sectors. We're talking about health, education, water, sanitation and hygiene, mental health and psychosocial support, quite many.
Likewise, the Ministry of Relief, Disaster Preparedness and Refugees in late March 2026 announced temporary halting the country's years-long open-door policy, citing diminished donor inflows.
Of the 20-odd countries that usually provide the bulk of the official development assistance, the majority of them are reviewing and reducing the levels of the funding that they usually provide.
The return of President Donald Trump to the White House in January 2025 was the icing on the cake of the painful and seismic shift. During his first week in office, he signed a raft of executive orders, including one pausing and later dismantling the U.S. Agency for Overseas Development, or USAID, in the spirit of keeping with his campaign promise of America First. Leonard Zulu, the head of the UN in Uganda, acknowledges that the ground for development finance is shifting significantly.
Especially last year and also continuing this year, those resources have been dwindling. We don't have as much funding as we used to have. Health and education sectors have been particularly affected.
Uganda's former permanent representative to the UN, Adonia Ayebare, says the two-pronged discussions on development finance and operational reforms have been around for a while.
Not only the US, by the way, China is also concerned about the UN because they are the second largest contributors now, about how the UN management is. So the UN 80 reforms are about two things. They are about to make sure that the UN really responds to the modern contemporary needs of countries. So the Americans have managed to get what they want, which is, cutting almost over $500 million, through programs and the Secretariat.
17 months since the shattering of USAID, international development aid finance is in a state of flux. Nearly every other traditional donor country is scaling back or re-evaluating official development assistance, leaving global crises half attended to or ignored.
The areas that is going to be affected is peacekeeping. Peacekeeping has become politically expensive and financially expensive. So we have to face the reality, and its effectiveness has also come to the spotlight.
And we are trying as much as possible at the United Nations agencies here in Uganda, with our partners, including government. We are trying to do more with less.
The UN too is jumping hoops in a liquidity squeeze since 2024, compounded by members delaying to remit their contributions.
For transformational change, you need the private sector. So we are increasingly looking to the private sector, private capital mobilization, to see how that can be used at scale in an impactful way to develop the country. And we've also been looking at what we generally term domestic resource mobilization, which is to see whether Ugandan resources can be used for Uganda's development, the sustainable development of Uganda. At the end of the day, the people with the primary responsibility of developing Uganda are Ugandans.
Some actors, including the US, are urging the UN to start exploring durable solutions, including repatriating refugees to their home countries if they are stable, such as the Rwandan refugees living in Uganda for the last 3 decades.